Hello everyone. Have you ever wondered why some people reach their 90s walking without assistance and with a mind as clear as water, while others lose their independence much earlier? The answer isn't in miracle pills or expensive treatments, but in daily habits you can start today. In this video, we're going to reveal the best-kept secrets for enjoying exceptional quality of life in your senior years. If you want to maintain your well-being, independence, and happiness for many more years, you can't miss a second of this content. And don't forget to subscribe to the channel to receive more tips that can completely transform your aging process. Don't forget to subscribe to the channel and comment from where it's coming from to appear in the next video. The search for solutions to maintain our health during aging is as old as humanity itself. We all dream of longevity accompanied by well-being. But beware, there's a lot of misleading information out there. Today we're going to analyze together some promises that are too good to be true and show you the real path to healthy aging. It's not about instant miracles, but about intelligent decisions that, day after day, build the foundation for a long and fulfilling life. Are you ready to separate myths from reality? Let's go. The myth of instant regeneration. When we talk about joint health and longevity, we encounter promises that seem straight out of a fairy tale. Have you seen those ads saying, "This natural food regenerates knee, cartilage in just 24 hours? How wonderful it would be if it were true." But the scientific reality is quite different, friends. The cartilage in our joints is a special tissue that doesn't have direct blood vessels, which makes its regeneration capacity extremely limited. The remodeling processes of this tissue are slow. We're talking weeks or even months, never hours. Even with the most advanced medical treatments, such as stem cell therapies, complete regeneration remains a considerable challenge. The International Society for Osteoarthritis Research confirms that currently, there is no method that can regenerate cartilage in just one day. This doesn't mean we should lose hope. Not at all. It means we need to be realistic and understand that caring for our joints is a long-term commitment. The real key to maintaining mobility during aging lies in the consistency of good habits, not in miraculous solutions. Have you noticed that people with the highest quality of life in their senior years tend to be those who have taken care of their diet and maintained moderate exercise for decades? Don't forget to like this video if you're already applying these principles in your life. The supposed anonymous expert. Another common trick in these misleading messages is mentioning a supposed 97-year-old orthopedist who has seen thousands of patients miraculously recover. What a coincidence that they never tell us his name, credentials, or where he works. This rhetorical strategy uses advanced age to suggest wisdom and experience, but without offering any verifiable evidence. It's what marketing experts call an appeal to anonymous authority, and it's a very effective tactic for convincing those desperately seeking solutions to their health problems. The truth is that real well-being during aging doesn't come from secrets kept by mysterious doctors, but from well-documented science accessible to everyone. Real specialists in longevity and joint health publish their findings in scientific journals, participate in conferences, and openly share their knowledge. They don't need to hide behind anonymity or promise impossible results. If we really want to improve our quality of life and enjoy active and independent senior years, we should seek information from reliable and verified sources. Do you know any health professional who has given you valuable advice about healthy aging? Share it in the comments so we can all learn. Foods and their true benefits. Now, not everything is negative. Many foods do have beneficial properties for our joint health, although not in the miraculous way some ads suggest. Take broccoli, for example. It's true that it contains sulforaphane, a compound with anti-inflammatory properties documented in scientific studies. A study published in Arthritis and Rheumatology showed that this compound can inhibit enzymes that degrade cartilage in laboratory models. That's fantastic. But there's a big difference between these findings and claiming that eating broccoli directly stimulates the regeneration of cartilaginous tissues. The same goes for salmon, rich in omega-3 fatty acids that have well-documented anti-inflammatory effects. A meta-analysis published in the Journal of the American College of Nutrition showed that these acids can reduce inflammatory markers in patients with arthritis. However, reducing inflammation is not the same as regenerating cartilage. Regular consumption of salmon can contribute to your general well-being and joint health, but it's not going to transform your joint health overnight as some promise. True longevity is built with patience, combining various nutritious foods in a balanced diet. If you're enjoying this content, don't forget to subscribe to the channel so you don't miss our upcoming videos on nutrition and healthy aging. Beyond promises, other beneficial foods. Continuing our exploration of beneficial foods, let's talk about vitamin C present in oranges. It's true that this vitamin is essential for collagen production, an important component of cartilage. Without it, our body would have difficulties maintaining the integrity of connective tissues. However, in people without severe vitamin C deficiency, additional consumption has not shown significant effects on cartilage regeneration. A study published in Osteoarthritis and Cartilage found no association between vitamin C intake and the progression of knee osteoarthritis in the general population. Kale is another frequently mentioned food for being rich in vitamin K and calcium, nutrients that participate in bone health. Although observational studies suggest an association between adequate levels of vitamin K and lower risk of osteoarthritis, clinical trials with supplementation of this vitamin show inconsistent results for joint health. Black beans provide vegetable proteins and minerals such as magnesium and zinc, important for general health, but there is also no evidence that they have a specific effect on cartilage regeneration. What we do know is that a varied diet, rich in these nutrients, contributes to overall health and can favor aging with greater quality of life and well-being. Which of these foods do you regularly include in your diet? Let us know in the comments. Fruits, tubers, and healthy fats. Blueberries are small nutritional jewels rich in anthocyanins, compounds with antioxidant and anti-inflammatory properties. Studies in animal models suggest that blueberry extracts can reduce inflammatory markers, and research published in the Journal of Nutrition showed positive effects of anthocyanins in reducing cartilage degradation in rats. However, studies in humans are limited and don't demonstrate the direct regenerative effects that some ads promise. Still, including blueberries in your diet can contribute to your overall health and possibly help maintain your joints in better condition. Sweet potato is another ally for healthy aging, rich in beta-carotene and other nutrients. Vitamin A, derived from beta-carotene, participates in cell differentiation processes and immune function. Although there are no clinical studies demonstrating a direct effect of sweet potato consumption on cartilage regeneration, this tuber remains an excellent option for a balanced diet that promotes longevity. Extra virgin olive oil, for its part, contains oleocanthal, a compound with anti-inflammatory properties similar to ibuprofen. Observational studies associate the Mediterranean diet, rich in olive oil, with a lower incidence of inflammatory diseases. A review published in the International Journal of Molecular Sciences suggests benefits of oil for joint health, although its effects are preventive and anti-inflammatory, not regenerative. Give this a like if you already incorporate these foods into your diet to improve your quality of life. Bone broth, miracle or exaggeration? Chicken bone broth has been promoted as a true natural miracle and practically an elixir for cartilage regeneration. But what does science say about it? It's true that this broth contains collagen, amino acids, and beneficial minerals. However, there is no robust scientific evidence that ingested collagen is preferentially directed to the joints. A study in the Journal of Medical Food showed that supplementation with hydrolyzed collagen can improve symptoms of mild osteoarthritis, but the effects are modest, gradual, and don't represent the miraculous regeneration that some advertise. Describing bone broth as an elixir or miracle is scientifically unjustified and can create false expectations in people seeking relief for their joint problems. This doesn't mean you should avoid bone broth. It can be part of a healthy diet and provide valuable nutrients. The important thing is to maintain realistic expectations about its benefits. The real key to joint health during aging is a combination of factors: balanced nutrition, adequate exercise, maintaining a healthy weight, and, when necessary, evidence-based medical treatments. There is no single magical solution, but a set of healthy habits that, maintained over time, promote aging with greater well-being and independence. Have you tried bone broth? Tell us about your experience in the comments. Understanding cartilage. Why it doesn't regenerate easily. To better understand why promises of rapid cartilage regeneration are unrealistic, it's important to know the structure and biology of this special tissue. Articular cartilage is mainly composed of chondrocytes, matrix-producing cells, and an extracellular matrix formed by type II collagen, proteoglycans, and water. Unlike other tissues, cartilage has characteristics that limit its regeneration capacity. It lacks blood vessels, it's avascular, has a low cell density, slow metabolism, and chondrocytes have limited proliferative capacity. When cartilage is damaged, the degeneration process involves an imbalance between matrix, synthesis and degradation, an increase in degradative enzymes such as metalloproteases, inflammatory processes mediated by cytokines, and excessive mechanical stress. Natural repair is limited to small superficial lesions, with formation of fibrocartilage, which is inferior to the original hyaline cartilage, and through slow processes that take months, not hours or days as some ads suggest. Understanding these biological limitations helps us have realistic expectations about joint health and appreciate the importance of prevention and continuous care to maintain mobility and quality of life during aging. Don't forget to comment if this explanation has been helpful for you to better understand how to care for your joints. Medical treatments with scientific evidence. Now that we better understand the limitations of natural cartilage regeneration, let's look at what medical treatments do have scientific backing to improve joint health. Physical therapy plays a fundamental role, helping to strengthen the muscles around the joints and improving joint biomechanics. A well-designed exercise program can significantly reduce pain and improve function, contributing to maintaining independence during aging. Regarding pharmacotherapy, there are options such as anti-inflammatories, analgesics, and chondroprotectors that, under medical supervision, can alleviate symptoms and potentially slow the progression of conditions such as osteoarthritis. Infiltrations with corticosteroids, hyaluronic acid, or platelet-rich plasma have also shown benefits in clinical studies. For more advanced cases, surgical procedures, from arthroscopy to joint replacement, can restore function and relieve pain. The important thing is to consult with health professionals to receive an accurate diagnosis and personalized treatment, instead of relying on miraculous solutions without scientific backing. Modern medicine offers many effective options for maintaining joint health and quality of life during the senior years. If this content is proving valuable to you, don't forget to share it with someone who might benefit from this information. Nutrition for joint health, beyond isolated foods. When we talk about nutrition for joint health and longevity, it's essential to understand that it's not about isolated, miraculous foods, but complete dietary patterns. The Mediterranean diet, for example, has shown benefits for reducing inflammation and improving various aspects of health, including joint health. This way of eating, rich in fruits, vegetables, fish, olive oil, and nuts, provides a combination of nutrients that work synergistically to promote general well-being. A crucial aspect that is often overlooked is weight control. Each extra kilogram exerts additional pressure on the joints, especially the knees. Imagine that for every kilo we lose, we reduce approximately 4 kilos of pressure on the knee during walking. This explains why maintaining a healthy weight is one of the most effective strategies for preserving joint health. Adequate hydration also plays an important role, as it is essential for the viscosity of the synovial fluid that lubricates the joints. As for supplementation, options such as glucosamine, chondroitin, and collagen have moderate evidence of benefit, but should be taken under professional guidance and with realistic expectations about their effects. Have you noticed improvements in your mobility by changing your diet? Share your experience in the comments. Lifestyle for healthy aging. Appropriate exercise is perhaps the most important pillar for maintaining joint health and promoting longevity with quality of life. Low-impact activities such as swimming, cycling, or water aerobics are excellent options that strengthen muscles without overloading the joints. Consistency is key. It's better to exercise moderately regularly than occasional intense sessions. Many seniors who maintain their independence have made movement a daily habit. Ergonomics also deserves special attention. Proper posture, appropriate footwear, and adaptations in the work and home environment can prevent injuries and reduce stress on the joints. It's important to avoid overloads such as repetitive movements, excessive impact, or extreme positions that can damage cartilage. Another fundamental aspect is the control of comorbidities such as diabetes and hypertension, which can negatively affect joint health. a comprehensive approach that combines healthy eating, regular exercise, proper ergonomics, and management of existing medical conditions offers the best opportunity for active aging with well-being. The key is in small, consistent changes, not quick or miraculous solutions. If you're implementing any of these habits in your life, like this video and tell us how it's working for you. The negative impact of misinformation. Misinformation about miraculous cures for joint problems is not harmless. It can have real and negative consequences. When people trust solutions without scientific backing, they often delay seeking effective treatments, allowing treatable conditions to progress and become more difficult to manage. This can seriously compromise quality of life and independence during aging. Additionally, many spend money on ineffective products that promise impossible results, resources that could be allocated to evidence-based treatments. Perhaps the most harmful is the cycle of false hopes, followed by inevitable frustration. Imagine someone with advanced osteoarthritis who places all their hopes in a miraculous food, only to discover weeks later that their pain and functional limitation persist. This disillusionment can lead to abandonment not only of that specific treatment but also of other potentially beneficial interventions, including necessary conventional therapies. Older people and those suffering from chronic pain are particularly vulnerable to these promises of quick cure, and misinformation disproportionately affects those with less access to health education. That's why it's so important to share evidence-based information about healthy aging and joint health. Don't forget to subscribe to our channel to help us spread reliable content about longevity and well-being, vulnerable populations, and ethics of information. Older people and those suffering from chronic pain are particularly vulnerable to promises of miraculous solutions. After years of dealing with limitations and discomfort, it's understandable that they seek relief wherever it's promised. Seniors, especially those with limited resources, may prioritize these supposed natural solutions to the detriment of essential medical care, putting their long-term health and well-being at risk. Misinformation about healthy aging disproportionately affects those with less access to health education or skills to critically evaluate information. It is our collective responsibility to protect these vulnerable populations by sharing accurate and evidence-based information. Health professionals, communicators, and family members have a crucial role in helping older adults navigate the sea of information about longevity and joint health. When we share verified content and demystify false promises, we are not only informing, but also empowering people to make decisions that truly improve their quality of life during aging. The ethics of health information is especially important when it comes to the well-being of our elders, who deserve honest and effective solutions to enjoy their golden years with dignity and independence. Do you know someone who could benefit from this information? Don't hesitate to share this video with them. A comprehensive approach to longevity. The path to healthy aging has no shortcuts or magical solutions, but it is full of opportunities to improve our quality of life. The key is to adopt a comprehensive approach that combines several elements: a balanced diet rich in anti-inflammatory nutrients, regular exercise adapted to our capabilities, adequate rest, stress management, and meaningful social connections. All these factors work together to promote joint health and general well-being during the senior years. It's important to remember that it's never too late to start taking care of yourself. Studies have shown that even people who begin exercising after age 70 experience significant improvements in their strength, balance, and functional capacity. The same goes for nutrition. Incorporating more fruits, vegetables, and quality proteins at any age can have positive effects on health. The real secret to longevity with well-being isn't in a specific food or a miracle pill, but in the consistency of healthy habits maintained over time. Every small daily decision, walking 30 minutes, including more vegetables on your plate, sleeping enough hours, adds up to build a longer life and, above all, with greater quality. If you're committed to improving your health to enjoy active aging, like this video. The importance of realistic expectations. Having realistic expectations about aging and joint health is fundamental to our emotional and physical well-being. The aging process brings natural changes to our body, including some decrease in flexibility and strength. Accepting these changes doesn't mean resigning oneself to severe limitations or chronic pain, but understanding that the goal is to optimize our health within real biological possibilities. not to seek eternal youth or instant solutions. People who maintain realistic expectations tend to be more satisfied with the results of their treatments and more committed to long-term healthy habits. Instead of getting frustrated looking for the miraculous cure, they enjoy the gradual improvements in their quality of life that come with consistent care. Additionally, these people tend to value more the positive aspects of aging, such as accumulated wisdom, deep relationships, and meaningful experiences. Happiness during the senior years doesn't depend on having perfect joints, but on maintaining enough independence to enjoy activities that give meaning and joy to our life. With the right approach, it's possible to age with dignity, well-being, and a positive attitude towards the challenges this stage presents. Don't forget to comment on what strategies you're implementing to maintain your joint health and enjoy healthy aging. Reliable resources for information on joint health. In a world full of contradictory information about health and longevity, it's crucial to know where to look for reliable data. Recognized medical associations, such as rheumatology, orthopedic, and geriatric societies, offer educational resources based on scientific evidence. Universities and research centers also publish updated guides and recommendations on managing joint conditions and strategies for healthy aging. These sources present balanced information, recognizing both the benefits and limitations of different therapeutic approaches. Health professionals remain our best allies for receiving personalized guidance. Doctors, physiotherapists, nutritionists, and other specialists can assess our individual situation and recommend appropriate interventions for our specific needs. Don't hesitate to prepare questions before your consultations and request clear explanations about available treatment options. Remember that knowledge is power, especially when it comes to our health. The better informed we are, the better decisions we can make to maintain our independence and well-being during the senior years. The search for reliable information is an investment in our future quality of life. If this video has been useful to you, help us reach more people by liking and subscribing to our channel. Conclusion: the true path to longevity with well-being. We have journeyed together through myths and realities about joint health and healthy aging. Although there are no magical solutions or miraculous regenerations in 24 hours, the good news is that we do have effective strategies within our reach to improve our quality of life during the senior years. The combination of a balanced diet, regular exercise adapted to our capabilities, maintaining a healthy weight, and when necessary, evidence-based medical treatments offers us the best path to longevity with well-being and independence. It's important to remember that every small action counts. We don't need to transform our life overnight. We can start with gradual and consistent changes that, over time, will have a significant impact on our health. Whether incorporating more vegetables into our diet, walking 15 minutes daily, or practicing muscle-strengthening exercises, each step brings us closer to more active and satisfying aging. The key is in consistency, not intensity. And most importantly, it's never too late to start. Studies show that even people who begin to adopt healthy habits at advanced ages experience remarkable improvements in their quality of life. The best time to invest in your future health is now. Which of these tips seems most useful for your life? Leave your opinion in the comments and share this video with someone who also wants to live a long and healthy life. Don't forget to subscribe and activate notifications so you don't miss our upcoming videos full of practical tips for your well-being. Until next time, I'm Dr. Martinez, and remember, it's never too late to start living better.